Well, we are so honored to welcome everybody and to be here with you for this session. For those who don't know me, I'm Dave Fuhrer, the CEO of Grit Health, and we are honored, deeply honored to be together with you for this session titled Harnessing Our United Strength to Create Meaningful Change. And I can't think of a better title for what we all hope our time together does to create meaningful change. Just before I get us started with today's session, I want to make one special note. We have scheduled and are creating a session specifically to support individuals and organizations in resiliency, and it is titled Cultivating Personal and Organizational Resilience. And it will be led by Gagan McDonald and some really amazing people who do both professional and organizational resilience training. It will be March 23rd from 11 a.m. until 12:30 p.m. Eastern, and we're starting a full hour earlier than we normally do to make sure that we can include our European and other advocates from around the world. So more to come on that, but just excited to create that session with you. So, okay, so getting started today, it is a special day because it is the kickoff, the launch of our working groups in 2021. We have designed together with you and from your feedback 4 working groups titled Racial and Ethnic Disparities, Access to Care, The Patient Voice, and The Future of Advocacy. And these have all been designed through a lot of input, feedback, conversations from you, the COVID advocacy members, and a desire to move from connection, which is what brought us together initially last year, to these really authentic and meaningful conversations, and now into creating tangible change. And we're excited to talk about what that means in the session today. We have 4 working group leaders who are advocates themselves, and they have spent their lives and their careers in each of these areas working for change. Sheila Thorne, I'll introduce in just a moment, and she's going to do our opening keynote. Neil Bertelson, Gary Nolan, and Brad Love are the 4 working group leaders. Plus, we also have a Grit Health team leader in each session. Our Grit Health team members are there to capture the key insights, troubleshoot if there's any problems. Please let any of them know in the chat after we move into breakouts how we can support the groups, as well as to share information after the sessions and between groups so that everybody can stay updated with what's happening. And the final component of these working groups is that we have a BMS champion or champions in each of these working groups. And they are there to learn from, to listen to advocates, and also to bring the industry perspective so that we can create together new and more meaningful ways to continue collaborating and creating change in the future. And we are deeply grateful to Bristol Myers Squibb and everybody on the team to creating this and being a co-creation partner with us. Okay, so not to stretch too long over my time, there's just 2 things I want to share before we get started. The first is that today is all about meaning. And even though we use the same words, they can mean very different things to each of us, or very different things at different points in our life. I served on the board of Stupid Cancer for 4 years. And when I think about the word advocacy, I think about good governance and fulfilling the mission and supporting the community and honoring donors and sponsors. And I asked Lauren on our team yesterday what comes to mind when she thinks of the word advocacy. And what she said is rolling over in bed and saying to your loved one, I need help. And I can't think of a more poignant example of how that one word can have such different meaning. And I want to share an example with you. And I think Megan Claire Chase is with us. She goes by the name Warrior Megsy, and she writes a blog titled Life on the Cancer Train. And I remember last May, she published a blog called Mixed Fragility. And in the blog, she wrote about her own self-hate from racism. When I read that last May, I sobbed, not just because of feeling how hard that can be for Megan. But because of my own lack of understanding, I have never felt self-hate from racism. And Megan's blog opened up a new understanding and a new place that I wanted to understand more deeply. And we hope that these conversations, these courageous conversations, let us all listen and share and speak openly in a way that we can be a part of meaningful change. And so I'm grateful to Megan and everyone who leans into these conversations and gets past the discomfort and is a part of coming together. Even though we may not have equal situations, we all deserve equitable care and life, not because of our similarities, but because of all the ways we're different and wonderful. Before we go into the working groups, you will hear from Tina Rippinger from What If Innovation. Tina is so excited to bring us together for these working groups. And in our prep, excuse me, she talked about collective strength, how much together we are stronger than alone. And she's going to share tools and techniques and some expertise from her innovation management work for us to use in our groups. And I now have the honor of introducing Sheila Thorne. Sheila is the president and CEO of the Multicultural Healthcare Marketing Group. She teaches and has lectured on health equity and cultural competency at Quinnipiac University, Rutgers, New York University, and many more. She's given more than 250 keynote and workshops specifically around cultural competency, anti-bias, and diversity issues. And it is my honor to introduce you to Sheila Thorne.
Hello, everyone. It's a pleasure and a privilege to be here. Thank you, Dave, for inviting me to this auspicious and esteemed group meeting. Thank you so much. It is indeed an honor and a privilege to speak with you today about a subject that is near and dear to my heart. And there's no doubt that racial and ethnic health and healthcare disparities have been plaguing our great nation for a very long time. Next slide. There is a difference between equality and equity. In the Declaration of Independence, it stated very clearly that all men are created equal, and we are still striving to achieve that goal. Equity is something different. That means we treat people according to their need, and that then helps us to become fair and equitable. And health equity is about ensuring that everyone has the opportunity to achieve their best health. But before we get into that, we need to put things in perspective. Next slide, Dave. If you were to shrink the Earth's population to a village of just 100 people, what would it look like? 82 of the 100 villages would be people of color. 74 of the 82 would be Asian, and only 9 would speak English. So that's a picture of the global village, where people we call minorities in this country have never been minorities. They're called that for the first time when they come to this country. And that term has become pejorative, because it's been associated with being poor, uneducated, uninsured, even criminal. So would you like to live in that village? What if your organization or your company was in that village? What would the staff look like? What would the programs that you develop look like? Clearly, this is what the global village is in terms of the world today. Next slide. But the United States is becoming a microcosm of that global village. Instead of the term minority, the more politically correct term is people of color. That has nothing to do with the pigmentation of your skin. It has more to do with shared experiences that these groups have with regards to discrimination and bias. And they've even added another dimension to that, BIPOC, Black Indigenous people of color, because it gives recognition to Native American Indians, Alaska Natives, Hawaii Natives. So this is the politically correct term to use for people of African, Hispanic, Latino, Asian, and Native American descent. So I caution you in terms of using minority, but this is the more inclusive, more positive way of framing that issue. Next slide. Well, we are indeed a mosaic. We aspire to be a melting pot where people come and harmoniously join together, but we're not quite there yet. But really, we are a mosaic, a patchwork quilt. Some have even called it a salad bowl. where each group who comes here tenaciously holds on to its language, its heritage, its history, and its culture while it makes up being a part of the whole. Yes, we are all grateful and thankful to be American, but we also have racial and ethnic pride. There's no doubt that of the 200 or more countries in the world, every one of them has somebody living in America. So we have never had a homogeneous culture or population, but for a long time, we pretended that it did, and we got away with it, but no longer. Rapidly shifting demographics are changing the complexion of America. It's getting darker, and it's never going back the way it was before. So before the middle of this century, 1 out of every 2 Americans will be a person of color or a person of color who speaks Spanish. Well, indeed, we have a task before us, how to strive for health equity for this diverse, beautiful cultural mosaic. Next slide. Even though these groups have made significant advances in education, in income, in political status, their health status has unfortunately remained the same. People of color get sick more frequently, they're screened for illness less often, they're diagnosed later, they're treated less aggressively, and they're buried earlier than other ethnic groups. That is unacceptable and unconscionable in this great country that we live in. So there are 2 kinds of disparities, both in health as well as health care. Next slide. But why these disparities? Why is it that people in this country, just because of the color of their skin, receive suboptimal care? Well, the first thing people point to is insurance, the fact that that many people have it, and poverty. And those are significant factors. However, look at the iceberg below the water. These elements, these situations are what really drives health outcomes and health behavior. These are called social determinants of health. So as we strive for advocacy and in terms of health equity, we need to address and acknowledge that these situations exist even among the middle class and insured. Next slide. It no more is apparent to us than when the pandemic was declared on March 11, 2020. And clearly, when I heard about this novel coronavirus coming to this country, as many of my colleagues in public health, we knew last year in November and December that it was going to impact these populations the most. And here is Dr. Fauci, who was asked, why are people of color getting more infected and dying sooner at greater numbers? And he identified, as he was testifying before this congressional committee, that racism plays a very strong part in this effort. So if we're going to achieve health equity, we must acknowledge that social determinant. Next slide. My dear friend, Dr. Kamara Jones, who was at NIH and CDC, was one of the first people who connected racism with health. And obviously, it is a public health issue. It is something that we have to definitely consider. But it's not just hateful acts. It's not just vandalism. It's a system of power. The fact that I will be denied quality education, quality housing, quality healthcare solely on the basis of what I look like. So race is not scientific. It's not biological. It has more to do with physical characteristics of what I happen to look like, of which I have no control. Next slide. And the one we hear about the most since the pandemic was declared is systemic racism. Whether or not organizations and companies have policies and practices that infiltrate and create unfair advantage. Next slide. But even if it were not the blatant forms of pathological racism that many in this country experience, there are the daily experiences that people of color endure, daily experiences, what we call microaggressions, whether you're in a restaurant, whether you're traveling, whether you're in your workplace or in your community or shopping. Those are the kinds of things that impact people of color regularly. Next slide. And clearly, racism is attached to a very specific kind of stress, chronic stress. And that stress leads to conditions that will not only exacerbate existing healthcare conditions, but also in terms of the prevention aspect, create a difficult situation for people of color. So this connection has been documented. Next slide. Even in the medical literature, that there is a correlation, there is a connection between levels of stress, chronic stress, as well as conditions like heart disease and cancer, respiratory disease, infectious disease, and we can go on and on. So that is an extremely important social determinant that we must acknowledge. It's not easy to talk about it, but it's something that if we are going to achieve equity and advocate for people of color, it has to be in the equation. Next slide. Just 2 weeks ago, another dear colleague and friend of mine, Dr. Ron Bailey, gave a presentation about the mental health impact of COVID-19. And the one phenomenon that is continuing to come to the fore is what is now called race-based traumatic stress. That's like pressing your foot on the gas and never letting up. So people that are on the front lines, EMTs, first responders, are experiencing this unique kind of stress that's based on race. That's difficult to manage, but the medical community, the mental health professionals are trying to address it. Next slide. And stress not only has an emotional and a psychological impact on a person of color, it does impact the body. There's a biological reaction. And obviously, this is not good for people who want to achieve health equity. So your organs don't really work well when you've got to suck it up and not really confront it because it's a daily occurrence. And that definitely exacerbates the health conditions that people of color disproportionately are affected by. Next slide. But these disparities are not new, ladies and gentlemen. This first was documented by the government in 1985 by the then Secretary of Health, Education, and Welfare, as it was called then. 9 volumes, 3,000 pages, and it came to the conclusion that people of color receive suboptimal care in this country. But what came out of this was positive things. It created the Office of Minority Health on the federal level, and every state now has an Office of Minority Health to stay on top of what's happening with these communities. Next slide. Fast forward to the year 2002, and Congress commissioned the National Academies of Sciences, the Institute of Medicine, to do a report. Is it really true that people of color don't receive the same quality of care? Well, 18 months later, studying hospital charts, studying outcome data, they concluded that people in this country who are of color receive less than quality care. And interestingly enough, they use the title unequal treatment, which is the language which is in the civil rights legislation. So this is a considerable landmark report. Why? Because it talked to insured people of color, not those that were uninsured. That's a different dynamic. Next slide. And then to 2015, Representative Kelly from the great state of Illinois issued another report just confirming the previous reports. And there have been a plethora of data to support that people of color, unfortunately, are disproportionately affected by chronic preventable disease. Next slide. That precipitated a movement of cultural competency, a term I'm sure you've all heard. And cultural competency is about reacting and responding to the differences so that we can see the needs, not only understanding them, but responding appropriately. And clearly this movement has been a train that has left the station and rushed across the country. It's a national movement. Next slide. So much so that the American Medical Association mailed this document, and it's a 300-page book, to each physician in its association to address the significance of culture, understanding attitudes and behavior of people of color, and how that impacts health outcomes, adherence, compliance, as well as prevention. Next slide. But this is a journey. This is not a destination. We are all educated, sophisticated, well-traveled people, and we hope that we do understand culture, but you have to understand your culture first and how your attitudes and your beliefs impact your interaction with people of color. This is a lifelong process, but it is an imperative. It is a moral, ethical, and business imperative, especially as we see these demographics continuing to be seismically shifted in this country. Next slide. But in my work and in my business, it's not just about competency, which are skill sets. It's about sensitivity. We all know not to use the N-word. We all understand that there are certain expressions, even if they're not verbal, that offend people. But we've got to have empathy. Walk a mile in the shoes of these folks before you judge and criticize their behavior or their lack of behavior regarding health. And here's the one I like the most: cultural safety. Do people of different cultures feel comfortable expressing their culture in your presence? They may have a different hairstyle. They may have different clothes. They may have different jewelry. Is it that makes them different, also makes them beautiful? So we want people to be safe and feel culturally safe. And the one I like the most is humility. The fact that all cultures bring value, all cultures bring benefit, and we can't assume that your culture is better than another's. So we've got to be humble. That's about humane medicine. That's about humility. It's powerful. It may not be something you always understand, but it's certainly something that we as advocates and activists should demonstrate. And isn't that in line with what the industry has been talking about for the last 2 decades? Patient-centered care, personalized medicine. Not only is age, not only is gender, but race a part of the whole person. Next slide. I had the privilege of being a part of the founding of the National Center on Cultural Competence in Primary Care out of Georgetown. And I was the only one from the private sector in that group. And clearly this was an opportunity for me. And quite frankly, I was the only one of the few chocolate chips in that cookie too. So clearly it was an eclectic group of healthcare professionals, but not necessarily an eclectic group racially. We took one day to create this continuum. So where are you on this continuum? Hopefully we'll talk about this a little more in our breakout session, because you don't want to be called incompetent, but that doesn't necessarily mean that you have to move up the rank in a different way. So where are you in terms of your level of cultural competency? If you need to move up, that's going to only enhance how you strive for equity, how you can be a better advocate. Next slide. So with this very brief presentation, we've got 2 ways to go. As Robert Frost says, 2 roads diverge in a wood. And I took the one less traveled, and that has made all the difference. That's what this group is doing, taking the road less traveled, because we want substantive change. We want new change. We know we have to be uncomfortable with the difficult conversation of race, because that's such a critical component of achieving health equity for all Americans. Next slide. But I want to end with something that I've thought about since I was a child. I used to play with these crayons like many of you did, but I was always confused by that beigey pink crayon they call flesh colored. Didn't look like my flesh. Well, next slide. I'm happy to report that the company that makes those crayons took it out of the box in 1992. It now has a line of crayons called Flesh Tones. So I'm in the box now. So clearly, if a company that has a product like this can adapt to the shifting demographics and make it more palatable for people of color, how much more so should we, as healthcare advocates and activists, striving for health equity? Next slide. So here we are. What we want for all Americans: quality, affordable, accessible, culturally competent, equitable healthcare. It is not a privilege, it's a civil right. Next slide. And so here we are, the launch of an extraordinary and amazing initiative that's going to bring many people together of all races and ethnicities to make sure that we are prepared to strive for health equity in this dynamic, shifting world of demographics in the United States in a multicultural marketplace. It's going to take each one of us to make a difference for all of us. So it is my pleasure and honor to present to you this beginning of this journey. Thank you. And I will turn it to Tina.
I was giving you the Zoom hands, the Zoom clap. That was fantastic.
Thank you.
Thank you so much. I don't know, Dave, if you have any introductory remarks or if I should just dive right in.
Go right ahead, Tina, please.
Great. I'll just again quickly introduce myself. Thank you so much for having me. My name is Tina Ripperger, and I'm with an organization called What If Innovation. We were recently acquired by Accenture, and What If is a company that focuses on innovation for growth. We really help our clients lead for imagining new growth futures, but also enabling growth cultures. And so I was really honored to talk with you today, because in much of my work, I'm also focused on really amplifying the message of advocacy groups and really putting the patient voice at the center of everything we do. So I'm really honored to be here today. So again, I'm really excited, but not only by what Sheila just described and really harnessing this group's collective energy, but also using a bit of what we wanted to discuss to ignite a bit of a collaboration and really harnessing the full potential of this organization to really work together to solve some of these big systemic issues. Because we know that we can't do this alone. We know we need to really make sure that we're all working together to drive the systemic impact. So very much excited to give you some tools and techniques that we use on a day-to-day basis when we train our clients to really be thinking differently, to harness an innovation mindset, and to really drive forward not only the mindsets, but the behaviors that you need to create that change. And as Lottie knows, I love to say behaviors eat process for breakfast. And so we believe that if you start small and really just change your mindset or behavior, it'll really drive that long-lasting change. There we go. Wonderful. Thank you. Well, we can page through a couple of these because I went through the introduction and who we are, but maybe we'll start with the purpose, process, and payoff, which is on the next slide. Great. So again, I really just want to expose you to some new ways of working and collaborating with one another. You know, the process that we'll use is very story-oriented, interactive, and I love to chat. I'm so excited to already see the chat flying on the screen, and so keep it going. But I also love the verbal interaction. So if you feel comfortable coming off mute and sharing any stories or asking any questions, I'm really happy to entertain as I go along. And the payoff is really this, hopefully giving you just some common language or tools or mindsets that you can apply immediately in these breakout sessions. So it's not a big academic exercise. It's really something that you can apply in the next hour. So we can advance to the next slide. We'll skip the next one. Great. You know, as Sheila mentioned, and all of the things that we have encompassed in 2020, you know, our world is changing at breakneck speed. You know, I really took a moment to reflect on 2020, and the healthcare industry at large truly did rise to the occasion in many ways, in terms of producing a vaccine in record speeds, making sure that our scientists and our caregivers really responded, but it also exposed a lot of the problems that so many people within the system are facing. And so this changing world, not only from an innovation challenge, but from a health equity point of view, requires all of us to think in new and different ways and really be agile in our thinking. So if you go to the next slide, you'll see, you know, some of the things that we witnessed you know, really require several mindsets and behaviors, but given the time, I thought I would just cover three. One is having an always on learning mentality. And I know just from hearing Sheila speak, how much I even learned from hearing so much of that and just being open to hearing new sources. So we'll talk a little bit about that. We'll talk about putting people first, and I know I'm singing to the choir on this point of view. All of you really lead with empathy and always putting people first, your own journeys to really care for and advocate for others. And so I know that this is something that will resonate with you. And then last is just this fluid collaboration and really igniting the power of this team to come together. So we'll start with always on learning, and you could advance through the next slide. So the next one, it really shows, and again, I mentioned, you know, this pandemic really forced us all to have a learner's mindset. Even the most entrenched life sciences companies, the largest organizations that I typically work with, down to the advocacy teams that we support, really had to embrace a completely new way of thinking. Everything we knew was upended and re-examined. But what I found most interesting is that purpose really drove the possibility. We were all galvanized by purpose. I know you all are here and you're in the careers that you are because you're driven by purpose, but it was also so fascinating to see how these large companies really came together. And so how can we continue to put that purpose first? And this is something that we talk about all the time. And I feel if you always lead with the purpose and the why, people are always more open to that possible. We also really showed the power of adaptability and audacity. We had to change our way of thinking, first of all, just by not being together and having to find new ways to communicate and connect in a digital way, but also to experiment with these new ways of working and to find a more audacious way to sustain some of the momentum that we needed to drive forward. So these are some of the things that we saw. And I don't advance to the next slide quite yet because it's going to give it a little bit of a way. But, you know, part of what I wanted to provoke or ask all of you is, you know, while we all had to put ourselves in that learner's mindset, if you would post in the chat, who do you think, if you look back in your lives, have the best learner's mindset, who are always thinking in an always on learning point of view. Yes, we got some great, exactly, kids, they are absolutely, so you can go to the next slide. What makes kids so great? You can start posting in the chat. What makes them so good? When they have that learner's mindset, why are children sometimes the best learners? What examples or behaviors do they exhibit? They're very open-minded, they ask questions, very trusting, exactly, unafraid. Fear is such a big reason why so many of us are afraid to move forward, right? We're very risk averse. A lot of times we're penalized for taking risks instead of encouraged. And yes, exactly, being more courageous. I love this. So that's exactly right. So if you go to the next slide, you're all spot on. I don't need to spend time on that. Kids are really, they're curious, they're fearless, they're imaginative. And this really helps to have a very expansive mindset. And by being a really proactive learner, it allows you to really embrace some of the things that we know kids do so well. Who may not be so good sometimes at having a learner's mindset? Anyone come to mind? Brad, no, of course you're not. Experts, exactly. I love that. Adults and experts. If you go to the next slide, we as experts, we're all here. We've really accelerated throughout our career because of what we've learned, our knowledge, our areas of study, our deep, deep understanding of our therapy area or whatever we've focused on. And it's so true that is valued and highly valued, and often why people call us is for our expert opinion. But sometimes when you are an expert, when someone comes to you with a new idea, you're used to having to judge it right away. You're used to having to evaluate it immediately. And very often that doesn't allow for that expansive thinking to really take place. And so sometimes these are very positive things. We need to be able to judge. We need to have rational thought in terms of how we bring things forward. We have to work within the rules, particularly within healthcare, within the constraints. But sometimes in innovation, you need to put that aside and really think about having more of a learner's mindset versus a knower's mindset. So if you go to the next slide, it really is the most important thing when you're in a moment that it's important to drive innovation forward, try to harness all the goodness that kids bring or the thoughts around what a real proactive learner drives versus having that knower's mindset. And one way to do that is through the next behavior on the next slide, which is what we call signaling. And it's very important when you're having a conversation or you're working with teams to let them know what mindset you want them to be in. There are often times when you're making decisions or you need to make urgent calls and you have to portray that knower's mindset. But when you're at the early stages, much like you're going to be when you're going into the breakout groups, you want to signal that you're at the early stages and the ideas you have are new. And you want to let them know and signal to them how you want them to be. So one quick ask on the next slide that you can immediately apply to show someone that you're signaling or indicating what mindset you'd like them to be in is when you come to them with an idea, instead of saying, what do you think about this idea, which very naturally will cause it to be judged or evaluated, say, could you help me build this? And just by that small tweak and how you're asking them to think, by nature, they are now going to go into more of an expansive mindset, really unpack more of a learner's point of view. And it's just a very small experiment that you could take away, whether it's in your breakouts or in your everyday, to just help people to know when and where you'd like them to act as you're starting to create new ideas. So that is the behavior of signaling and the learner's mindset. And then the next slide, you'll see, I'd love to challenge you to think through either in this breakout or what's next, what do you most need to learn? And especially as we're thinking of health equity, I think everyone has to really learn so much and to think very differently about how you're going to address some of these systemic issues. And so write a note to yourself or really have a thought about, what do you want to learn most? And then put a bit of an action plan in thinking through how you can actually start to learn that, whether it's reading books, having a conversation with a colleague, really put yourself out there to think and be vulnerable around what you can learn more about on your particular topic. So on the next slide, we can skip through the title. I'd love to talk to you a little bit about, empathy. And I'm not going to go too far into this one because, again, all of you are the biggest champions of this. But very often we have to talk to our clients, and you'd be surprised, even in people who dedicate their lives to healthcare, sometimes they're very far removed from the patient, or they're far removed from that end experience. And so how can we constantly be bringing that people or patient first mindset to make sure that we're solving for the right problems? So we always coach you to be problem obsessed and solution agnostic. Really think about what is the problem I'm trying to solve, instead of saying, wow, I've got this really great solution that I'm forcing to find an answer or a person that it can apply to. By always starting with the problem, you'll always get to the right solution. And one of the techniques we use on the next slide is to be always asking why. If you find something, we have to have this curious mindset. And if you think about the ultimate in curiosity, it's truly having a genuine interest in the world around you and trying to find out the root cause of what's happening. And we at What If often ask why 5 times. Anytime we're interviewing someone or we find something that's happening, there's always a next layer, there's always something deeper. And by just poking and prodding and understanding more and having that true curiosity paired with that learner's mindset is a true advantage. But we don't just ask why in the traditional format. So if you go to the next slide, we're giving you a little helpful tool to think about. Also, how you ask why and how you think about it. So for us, we think, what do you know? How do you know it? And are you sure? And again, this really supports that thought, which is, we know so much as leaders and as business people, but do we really, let's think about how we know that to be true. Is it influenced completely by our experience? And very likely, can someone else have experienced that same set of problems in a very different way? And by just opening yourself up to think about that why question personally, and then always also asking that of others, truly will set you up for having that patient first or problem oriented mindset from the start. And the last big behavior I'd like to talk about is this fluid collaboration. So if you go to the next slide, what we found, with 2020 and how successful clients were, it was really that they had the ultimate collaborators mindset. They couldn't think within the silos that they traditionally organized in because the problems were so big and we had to move so fast that it was critical to break down those boundaries, not wait to hand it over and to wait to talk to someone else because of a particular stage gate. You really have to think in new ways to work outside your team, work outside your organization, find complementary organizations, or even outside of healthcare to potentially find some of the best answers to solve problems. We've also seen that, resource fluidity was really important, and it's not just financial, it's time, talent, data, really sharing our information with one another. You might not see, they might help to spark new things and new ideas. And so by unlocking some of those resources, it really does help to create ultimate collaboration. So on the next slide, I'll give you one more behavior. And this is called greenhousing. And at What If, we sometimes say this is the ultimate of all of our behaviors. This is really the most important behavior that we have. So what do people know about greenhouses? Why don't you put it into the chat? What does a typical classic greenhouse do? Nurtures life, gives you space to grow. Lots of light. Oh, I love it. That's exactly right. A greenhouse in a context of an idea really fosters the exact same things that you're putting in the chat. It gives space for things to grow. It protects and nurtures young seeds of ideas and really helps them grow. Not all seeds that we put into the greenhouse will grow up to be roses. Some may turn out to be weeds, and that's okay. We just need to give it the time and the space to allow it to give it a chance to see what it might come to be. And so greenhousing is probably the best behavior that we can kind of share with you, because especially if you've signaled that you're at the early stages of building an idea, you want your team around you to protect and to greenhouse this idea until it's ready to be judged, which may come very quickly. It's not a green light, but it is something that's important. So we have one more technique that we'll give you when you're thinking about greenhousing. And on the next slide. So someone put lots of light in the text, and this is exactly right. And we took that idea and we created the sun technique. And what we mean by the sun technique with greenhousing is first, suspend judgment. Again, so many times when people bring us to ideas, it's so easy to immediately react and to start judging or giving your feedback, but just take a minute and just stop and suspend how you're thinking about or how you're judging that idea. The next is really to seek to understand them. Why did they bring this idea to me? What do you think is the reason behind it? And what is their perspective? Maybe it's something different than I have been thinking. And the last is to nurture their thinking. Really ask them provocative questions, talk about it, really go through a couple different levels of conversation to nurture their thinking. And really, again, with that signaling concept, help them to build it. This not only gives the person who brought you that idea so much more satisfaction. You end up getting, usually starting with the beginning of an idea, but because you were able to greenhouse that idea, you probably made it even better and bigger than it could have been when they first came to you. And people will often come to you for your expertise. And so having that ability to just have a great, thoughtful conversation with you around their idea, you have no idea how far it goes to having people feel satisfied in their work and in their day-to-day life. So as you're going into the breakouts, definitely if you hear someone mentioning an idea and you may not agree with it, or you may think, I don't know if that'll work, we've tried that before, just suspend your judgment, seek to understand and nurture the thinking. So that is the greenhousing sun technique. And I know I just have a few more minutes, so if we go to the next slide, I just wanted to leave you with a little bit of inspiration as you head into your groups in addition to the behaviors. And the first is a little social contract that I'd love for all of you to enter into when you go into the next set of conversations. So I'll start with the middle one. We talked about it in our behaviors is people's, customers, patients' shoes. Really try to understand the true heart of the problem that you're trying to solve and try to put yourself in their shoes. Really be grounded in who you're here to talk about today, and make sure that you leave your own kind of thoughts behind, but really put yourself in that experience, and that will really be important. The next thing is share your voice. I have no doubt that this is the most active crowd. I love all the chat energy, and sometimes you feel great to do it in chat. Again, others, if you want to come off of mute and share your voice, we really learn most when we hear from you, and we build and collaborate together. So in whatever way you feel comfortable, please, make sure you share your voice in the breakout. And the last is probably my favorite, even though we put it first. It's our little friend Elmo from Sesame. And he, even though we all know and love him, what if we have renamed him and used the acronym to stand for enough, let's move on. So your facilitator may have to call an Elmo because you only have a limited time together. And if we've landed the point and we need to move on to the next, they may call an Elmo. You can use it within the group. And if you realize you're maybe talking a little too much, you can Selmo. So feel free to think about that. It works at work and it also works at home. So it's a great one. We even sometimes, when we used to be in person, bring a little Elmo and we throw it around the room to make sure that everyone knew what's important. And usually, only it's because in service of momentum and taking advantage of all the time we have. So we maximize it. So a couple of fun little agreements. If everyone agrees to these agreements, can you put a little woohoo in the chat for me? Woo, okay, great. Thank you. All right, my last slide, if you want to go to the next. Okay, so I have this incredible idea. And there's a new tool. You can't tell that I'm that functional with Zoom, but I did find a really interesting tool called the Spotlight feature. And so just to get you excited for the breakouts, I thought I'm going to use a Spotlight feature. It scrolls through the Zoom faces, all of you at random, and it will pick one person. And I'm going to have you sing out your very favorite song, just to kind of show how vulnerable we can be. So, all right, so I'm going to hit send. Who does it pick? Let's see. Are you ready to think about your favorite song while it's scrolling? I'm just kidding. We're not going to do that. Just a little joke, I promise. I'm sure a lot of you feel really relieved. Yeah, somebody just fainted. I know, exactly. That was kind of the intent. If you go to the next slide. I didn't mean to terrify you. Hopefully I didn't let you go on too long with that one. It's just a little fun way of, talking about our last behavior, which is bravery. Bravery is so important in innovation. And, so many times you're called upon to really challenge the status quo, to think differently, to put yourself in a vulnerable situation, to not only, get your best ideas out of yourself, because so many of us probably have something on the tip of our tongue or an idea that we're excited to share, but you're a little bit nervous about it. But so is your neighbor, so is your colleague. And so being brave is really important to stretch yourself. And, we have the lion as our, bravery icon, but actually we like to reframe it, and it should be the butterfly, because I'm sure when I said to be brave, all of you probably felt that little nervousness in your stomach and felt those butterflies. If you feel that again, when you're in a meeting or in your context that knows that you're in a situation where you're about to truly be brave and to lean into that, take that risk. And very often people will be so happy that you did. And by really having the same common language, you'll be in a very safe place to share your ideas, to nurture some big thinking, and really try to solve some of these big human problems that we're all here and have dedicated our careers to solving. So with that, thank you so much for the time. I hope these were some practical and techniques that you can all use and apply in the breakouts today. So thank you for having me, everyone.